If your nails keep breaking, splitting, or peeling, it's easy to blame bad luck or weak nails. But nails are made from keratin, and keratin is built and maintained by your overall nutrition, hormones, and daily wear and tear. So brittle nails can be a simple lifestyle issue, or they can be a clue that something is missing. In the next few minutes, you'll learn the most common nutrient deficiencies linked with fragile nails, especially iron and zinc, and how to think about them without guessing. You'll also learn the non-nutrition reasons nails break, because supplements won't help if the real problem is water exposure, harsh chemicals, or a nail habit you don't notice. The goal is a practical checklist: what to look for, what to ask your clinician to test, and what changes often help over a few months. Nails grow slowly, so the best approach is calm, consistent, and measurable. Let's start with what brittle really means. Moving to slide 2. Before talking nutrients, it helps to define the problem. Nails can break at the tip, split down the middle, or peel in thin layers. Those patterns can point to different causes. Peeling layers often happen when nails repeatedly swell and dry out. Think dishwashing, frequent hand sanitizer, or long hot showers. Splits and cracks can come from mechanical stress, like typing with long nails, opening cans, or using nails as tools. Another big factor is nail cosmetics. Frequent gel or acrylic removal, aggressive buffing, and acetone soaks can thin the nail plate and make it feel soft, even if your nutrition is fine. Also notice whether it's all nails or just a couple. 1 or 2 nails breaking is often local trauma. All 10 nails changing over time raises the odds of a systemic issue like low iron, thyroid imbalance, or low protein intake. This step, pattern and distribution, keeps you from chasing the wrong fix. Moving to slide 3. Now let's talk growth, because nails don't change overnight. Fingernails grow roughly a few millimeters per month, and full replacement can take several months. That means if you correct a deficiency, you usually won't see a dramatic change in a week. You're watching for new, stronger growth from the base, not a sudden repair of the old, damaged tip. It also means short-term miracle products can be misleading. A hardener may make nails feel tougher, but it doesn't rebuild the deeper structure if the underlying issue is nutrition or repeated wet-dry cycles. When you evaluate any change, diet, supplements, gloves for cleaning, give it a consistent trial. Take note of break frequency, peeling, and how far the splits travel. If you can, keep nails at a practical length during the experiment, because long nails magnify stress. Think of nail improvement like hair improvement: slow, steady, and trackable. Moving to slide 4. Iron is one of the first deficiencies to consider with brittle nails, especially if you also feel unusually tired, short of breath with exertion, or notice hair shedding. Iron supports oxygen delivery through hemoglobin, and low iron stores can affect fast-growing tissues. Some people also notice spoon-shaped nails called koilonychia, though that's not required for iron to be relevant. The key detail is that iron deficiency can exist even before anemia shows up on a basic blood count. That's why clinicians often check ferritin, which reflects iron stores, along with hemoglobin and other iron markers. Low ferritin can have many causes, including heavy menstrual bleeding, low dietary intake, frequent blood donation, or absorption issues. If iron is low, the goal is to find the reason, not just add iron blindly. Too much iron can be harmful, so testing and guidance matter. If iron is part of your picture, nail changes typically improve only as new nail grows in. Moving to slide 5. Zinc is another nutrient strongly tied to nail quality. Zinc helps with cell division, protein synthesis, and tissue repair, which matters for the nail matrix, the growth zone under the cuticle. When zinc is low, nails may become brittle, develop ridges, or show white spots and slow growth, although those signs are not specific. Zinc deficiency risk goes up with restrictive diets, low overall protein intake, chronic digestive problems, and certain life stages with higher needs. One practical clue is frequent infections, slow wound healing, or changes in taste and smell, which can sometimes travel with low zinc status. Testing zinc is possible, but results can be tricky to interpret, so clinicians often look at the whole picture: diet patterns, symptoms, and other labs. Also, more is not better. High-dose zinc over time can reduce copper absorption and create a new problem. If you supplement, it should be targeted, time-limited, and ideally monitored. Moving to slide 6. Protein is the quiet, underrated factor. Nails are largely keratin, and keratin is a protein structure. If you're consistently under-eating protein, your body may prioritize vital organs and muscle repair over cosmetic tissues like nails and hair. This can happen with very low-calorie dieting, poorly planned plant-based eating, or simply skipping meals and relying on snacks. The fix is not extreme, it's consistency. A solid protein source at each meal, and enough total calories to match your needs. For plant-based diets, variety matters. Beans, lentils, tofu, tempeh, edamame, seitan, and higher protein grains can help. For omnivores, eggs, dairy, fish, poultry, and lean meats are common options. Also consider that protein works with micronutrients. If you raise protein but still have low iron or zinc, nails may improve only partially. Think of protein as the foundation. Without it, the building materials for nails are limited. Moving to slide 7. Biotin gets a lot of attention for nails, and the truth is nuanced. Severe biotin deficiency is uncommon, but when it does happen, it can affect hair, skin, and nails. Some small studies suggest biotin may help certain people with brittle nails, possibly by improving nail thickness. But it's not a guaranteed fix, and brittle nails often have other causes, like water exposure or iron deficiency. The most important biotin detail is safety around lab tests. Biotin supplements can interfere with certain blood tests, including some thyroid and cardiac markers, and that can lead to confusing results. If you take biotin and you're getting labs, tell your clinician. Food sources like eggs, nuts, seeds, and legumes are generally fine and don't create the same issue. If you're considering a biotin supplement, treat it like an experiment with a timeline. If there's no clear improvement after several months of new nail growth, it may not be your lever. Moving to slide 8. Vitamin B12 and folate matter because they support red blood cell production and DNA synthesis, which affects rapidly dividing tissues. If you're low in B12, you might notice fatigue, numbness or tingling, balance issues, or memory fog along with changes in nails and hair. Folate deficiency can overlap with similar anemia-like symptoms. B12 deficiency risk is higher with vegan diets without reliable supplementation, older age with lower stomach acid, and certain digestive conditions. Testing usually includes serum B12 and sometimes additional markers like methylmalonic acid for clarity. For nails, the key point is that these vitamins influence growth quality indirectly through cell turnover and oxygen delivery. If your nails are breaking and you also have neurological symptoms, that's a reason to take B12 seriously and get evaluated sooner rather than later. As with iron, the goal is to identify the cause, dietary intake versus absorption, because that changes the plan. Moving to slide 9. Vitamin D and calcium are better known for bones, but they can still be part of the brittle nail conversation. Vitamin D influences many tissues, including immune function and inflammation, and low levels are common in people with limited sun exposure. Calcium is essential for structural functions in the body, but nail brittleness is not a classic direct sign of low calcium the way people assume. Still, if your overall diet is low in calcium-rich foods, or you avoid dairy and don't replace it well, it's worth checking your intake. Magnesium also plays supporting roles in protein synthesis and cellular function. The practical takeaway is this: if your diet is narrow, your nails may be showing the cumulative effect of multiple, almost low nutrients, rather than one dramatic deficiency. A clinician may check 25-hydroxyvitamin D and discuss dietary sources like fortified foods, dairy or alternatives, leafy greens, fish, and legumes. The goal is balanced adequacy. Moving to slide 10. Sometimes the deficiency is not a vitamin at all. It's hydration and barrier damage. Nails absorb water. They swell, then they dry and shrink. That repeated cycle can separate nail layers and create peeling at the tips. If you wash dishes, clean a lot, swim frequently, or use alcohol-based sanitizer many times a day, your nails may be living in that swell-dry loop. The fix is mostly mechanical and protective. Use gloves for wet work when you can. Keep nails slightly shorter and smoothly filed to reduce snags. Moisturize hands, but also target nails and cuticles with an oil or thicker cream, especially after washing. Another overlooked factor is picking and biting. Even mild, absent-minded picking can create micro cracks that turn into splits. If your nails improve on vacation or during a break from chores, that's a strong clue the main driver is exposure, not iron or zinc. Lifestyle causes can coexist with deficiencies, so it's not either or. Moving to slide 11. It's also important to know when brittle nails point beyond nutrition. Thyroid disorders can affect nail growth and texture, often along with changes in energy, weight, temperature sensitivity, skin dryness, and hair. Iron deficiency and thyroid issues can overlap, which is why a broader evaluation sometimes makes sense. Skin conditions like eczema or psoriasis can involve the nails too, causing pitting, lifting, or thickening that looks like breakage. Fungal infections can make nails crumbly or discolored, and that won't respond to minerals. And certain medications can affect nails indirectly by changing skin dryness or growth patterns. The practical rule is, if you see major color changes, pain, swelling, separation from the nail bed, or one nail that looks very different from the rest, get it checked. Nutrient support is useful, but you don't want to miss a dermatology issue that needs a different approach. Think of nutrition as one lane in a bigger diagnostic map. Moving to slide 12. If you want a smart, low guesswork plan, start with a simple nutrition and exposure audit. For 1 week, note your protein at each meal and how often your hands are in water or chemicals. Then consider whether you have risk factors for iron or zinc deficiency, heavy periods, low red meat intake, frequent blood donation, long-term digestive symptoms, or a very restrictive diet. If those apply, talk with a clinician about targeted labs. Common ones include a complete blood count, ferritin and iron studies, B12, folate, thyroid-stimulating hormone, and sometimes vitamin D. Don't order everything just because nails are breaking, but do match tests to your personal risk profile. While you wait, do the basics that help almost everyone. Keep nails shorter, file gently in one direction, moisturize nails and cuticles, and use gloves for wet chores. Then recheck progress after 2 to 3 months, because that's enough time to see new growth quality. Moving to slide 13. Let's wrap this into a clear takeaway. If your nails keep breaking, think in layers. First, reduce damage. Less soaking, fewer harsh removals, fewer mechanical nail as a tool moments. Second, build the foundation. Adequate protein and overall calories, plus a varied diet that regularly includes iron and zinc-rich foods. Third, use testing when the pattern suggests it, especially if you also have fatigue, hair shedding, frequent infections, digestive issues, or heavy menstrual bleeding. And remember the timeline. Stronger nails show up as new growth, not as instant repair. If you want, I can also outline iron and zinc-rich meal ideas for different diets, like omnivore, vegetarian, or vegan, without turning it into a complicated plan. For now, I'm curious about your pattern. Do your nails mostly peel in layers, or do they crack and split? Leave a comment with A for peeling or B for splitting, and if you want more evidence-based checklists like this, subscribe. This information is not a substitute for medical advice.